Today, we're diving into the fascinating and totally paradoxical world of ketamine. Alright, here's how we're going to break this down. First, we'll look at what would make a perfect anesthetic. Then, we'll see why ketamine is in a league of its own and understand the unique state it puts people in. After that, we'll unpack how it works, look at its contradictory effects, and finally, give our verdict on where this powerful tool really fits.
So, before we can really get why ketamine is such an oddball, we need to take a step back and ask a really basic question. What are anesthesiologists even looking for in the first place? What does the perfect IV anesthetic actually look like?
You know, this single question has been the driving force behind decades of drug development. Anesthesiologists have been on this long quest for a kind of holy grail drug. One single perfect agent that could work safely and effectively every single time.
And man, this wish list it's a lot. I mean, you want a drug that kicks in fast and wears off just as quickly. It needs a super high therapeutic ratio, which is just a fancy way of saying there's a huge safety margin between a helpful dose and a harmful one. Ideally, it doesn't mess with your heart or breathing, doesn't cause weird dreams when you wake up, and it even works as a painkiller at low doses. Oh, and on top of all that, it should be stable and cheap. It's a really tall order.
And here's the kicker. That perfect drug, it doesn't exist. Not a single one checks every single one of those boxes. And that's exactly why anesthesiologists don't have a magic bullet. They have a toolbox full of different drugs with their own unique pros and cons.
Okay, so let's pop open that toolbox and take a look inside. Where does ketamine fit in all of this? Well, as you're about to see, it's kind of sitting off in its own corner. And there it is. I mean, look at that. You've got your usual suspects, propofol, thiopental, all in these familiar groups, and then you have ketamine, all by itself in its own class, the phencyclidines. Its chemical family is unique, and that's our first big clue that this drug is going to behave very differently.
That different behavior leads to a completely different kind of anesthesia. This isn't about just making someone fall asleep. No, this is about creating a state of, well, profound disconnection.
This right here is the core of what makes ketamine so strange. Instead of shutting the whole brain down, it functionally disconnects the mind from the body. The patient is sort of awake, but not aware. They aren't processing their environment. And what's really wild is that their basic airway reflexes often stay intact, which is a major departure from other anesthetics.
So how on earth does it do that? How does it create this bizarre, disconnected state? Well, the answer lies in where it works in the brain and how it does its job.
This slide just nails the difference. Think of most anesthetics, on the left there, like a dimmer switch for your entire brain. They just turn down the lights everywhere. But ketamine, it's more like a rogue telephone operator. It doesn't shut the whole system down, it just unplugs the cable that connects the sensory information to the part of the brain that's consciously aware of it. The signals are sent, but they never actually arrive. And here's how it pulls that off on a molecular level. Ketamine is basically the perfect shape to fit into and block a very specific channel in the brain called the NMDA receptor. By gumming up that specific pathway, it creates that profound sensory blockade we've been talking about.
So because of this really unique mechanism, you get a profile of effects that is just a study in contrasts. Seriously, when you put it side by side with other drugs, the differences are absolutely stunning.
First off, the practical stuff. For anyone in medicine, this is a super high-yield number to have in your back pocket. The typical IV dose to induce anesthesia is 1 to 2 milligrams per kilogram. It's a pretty small dose, but it produces some dramatically different effects. Okay, now look at this. This is the first major paradox. Most anesthetics, like propofol, they cause a drop in blood pressure. That's pretty normal. Ketamine does the complete opposite. It causes a big increase in both blood pressure and heart rate. It's totally backwards.
And the reason it does that is because ketamine directly stimulates the body's fight-or-flight response, the sympathetic nervous system. It's like stepping on the gas pedal of the cardiovascular system, while most other agents are gently tapping the brakes.
And the contrasts just keep coming. It's a powerful bronchodilator, which is fantastic for a patient having an asthma attack. It provides incredible pain relief, unlike a lot of other agents. But on the flip side, it also increases blood flow and pressure inside the skull, which makes it super dangerous for patients with a head injury. See what I mean? It's a drug of total opposites.
So, with all these paradoxes, what's the final verdict? What do we do with this drug? Well, it's pretty clear that ketamine isn't a master key. It's a very specific tool for a very specific job.
And here is the single most important takeaway. A drug's properties are only side effects in the wrong context. For the patient on the left who has heart disease or a head injury, ketamine's effects are dangerous. But for the patient on the right, someone in shock with dangerously low blood pressure or having a severe asthma attack, those exact same properties aren't side effects at all. They're life-saving interventions.
And this brings us right back to that core paradox. It really forces us to ask, is a drug's effect a dangerous side effect, or is it a therapeutic lifeline? And the answer, as ketamine perfectly demonstrates, is that in medicine, it's never about whether a drug is good or bad. It's always about choosing the right tool for the right patient at exactly the right time.